Well, I think we can go ahead and get started. It is 10 a.m. on Pacific time on the West Coast, 1 o'clock East Coast of the United States. And I'm your host. My name is Steve Shevland, and I am the founder and CEO of Emerging Global Services. A lot of people know us as EGS. Sometimes it's a little simpler to say that. And I want to say good morning to you, or good afternoon to you, or wherever you, I guess, good evening if you're in another part of the world. Thank you for joining us here to talk about why outsourcing patient processing and healthcare administrative workflows are no longer optional. Now, joining me is my our Chief Operating Officer, Adrian Reynoso. Adrian, can you hear me okay?
Yes, I can.
Good, good. So thanks for joining, Adrian. This webinar is going to be maybe a little bit different because I know a lot of times different webinars have different guests and a variety of different guests that join. However, this time, Adrian and I were talking about wanting to just have more of a conversation. And it's just he and I at the moment, because over the last almost 12 years it's been since we founded EGS, we have been doing a lot of work in healthcare. And we as an organization have worked in a lot of different industries, but we've really focused heavily in the healthcare market because what we've seen over the last many years is just a number of cost pressures and lowered reimbursement issues and a whole host of pressures that are on healthcare organizations. And we are at our core, we are in the outsourcing industry. We are headquartered in Phoenix, Arizona. We have roughly 3,000 plus employees in northern Mexico, hop, skip, and a jump from Phoenix. And these are highly skilled, highly trained, highly educated professionals who are doing a whole host of different types of work for healthcare organizations. So hospitals and community health, which can be federally qualified healthcare clinics, rural health, obviously nonprofit, community health hospitals. But we also handle and support a lot of healthcare organizations in various specialty practices, such as radiology and ophthalmology and dental. And, the list goes on and on, cardiology, all of these different specialty practices. And so Adrian and I thought, maybe we'll just have a conversation a bit about what we're seeing in the market in healthcare and what our experience has been over the past many, many years in this healthcare market space as compared to what we have done in other industries. So that's really what it's going to be, is just a conversation, and then we'll have a chance for some Q&A and 25, 30 minutes or so. So Adrian, do you want to say anything to start out, introduction of yourself or what have you?
Well, yes, a little bit of a background of both of us is that we live and breathe call centers, business person outsourcing, technology. We're really passionate about technologies, new technologies. And we combined have over 50 plus years of experience.
Yeah.
And doing this.
I'm getting old now. I can feel it. Anyways, I'm getting some gray hair, Adrian.
Yeah. So no, yeah. And the main situation we were able to identify is the new reality where basic activities and tasks and operational and admin needs for healthcare industries were not sustainable to be to keep it in house, to keep doing it locally. So we identified that a lot on the healthcare industry, a lot of the clinics, FQs, hospitals have their internal call centers, internal teams performing these type of activities where they're not experts. So that's not their core business.
Right.
And that's where we can bring our expertise and our knowledge base to optimize their efforts, not only their resources, as you were saying, Steve, but their attention. They shouldn't be worried about keep recruiting enough staff to handle phone calls.
Right.
Keep focusing on metrics that they're not experts on. So they know the healthcare ins and out, and they still gotta be doing it. So it's more of a complement a service that we provide them. So I think you should share um, the anecdote, Steve, with one of the
Oh yeah.
citizens of Golden Valley. What he
Yeah, I can do that with one of our clients, Golden Valley Health Centers. They're in the Central Valley of California. They are a federally qualified healthcare clinic, amazing organization run by amazing people, doing amazing things. But over the years, they had built up a fairly large in-house support operation, meaning they have, I don't know, I can't remember, 70 some clinics that they operate. And then they have this in-house operation of staff, of call center staff, and a whole host of data entry clerks and this and that, who are having to handle everything from scheduling, which is obviously in the healthcare space, something has to be scheduled. No revenue happens that is generated unless an appointment is scheduled. So you've got to not only fill up all of your provider appointments, but then the other piece of that is you want to minimize no-shows or eliminate no-shows as much as possible. And so they were having a lot of those issues. And then they were having issues with turnover. If you look at a administrative or support organization or a call center support organization, you may have the top 1/3 of employees and the middle 1/3 of employees that really are great people, great employees. But every organization always has that bottom 1/3 where you have turnover, you have issues. And so that gets expensive. And if you look at this first slide we have right here, the cost crisis for healthcare providers, we're just talking about this one client of ours at the moment, Golden Valley, who, the CEO at one point said to me, he goes, I'm not sure why we're trying to staff all of these people at this very high cost in California. Now, here you look at the math, $50 per hour in high cost states like California. I mean, if it's not 50, maybe it's 45, maybe it's 54. I don't know what the exact number is. Every organization knows that. But that's a lot of money for staff in the organization that, I don't want to say that they're not critical. I don't mean to imply that the jobs are not important, but in reality, you want to allocate as much of your cash position, as much of your budget to delivering healthcare to patients, investing in facilities, equipment, and doctors and nurses and all of these all of this staff who are really adding value in patient care. And this organization also, they were having very high turnover, 30 to sometimes even up to 60% some months. And when you look at this here, every employee costs 6 to 9 months of their salary to replace. So if you have a staff of 120, and then you've got 20 or 30 that are turning over every 30, 60, 90 days, you're just it's like you're a car, a wheel stuck in the mud. It's just very expensive and hard to stabilize that. And so outsourcing becomes an excellent way to stabilize things and to free up cash that you can invest back into your patient care. So we get into other industries, and Adrian, I know you, outside of healthcare, we've worked in healthcare a long time, but you and I and I know you even have more experience in other industries in the outsourcing in world other than just healthcare. And you go back to the early 2000s when outsourcing, obviously India became big, the Philippines became big, and Latin America, now Africa is big. You know, Other industry, banking, insurance, telecom, they really pioneered this space, if I'm not mistaken, right?
Yes, that's correct.
I mean, they realized, why are we trying to staff a 250 seat call center in
Yes.
Pittsburgh or Cleveland, wherever they're at? It's okay to keep 20, 30 of your core high quality people. But a lot of these jobs, a lot of these roles could be handled by a labor arbitrage market.
And another thing, Steve, is that a lot of the healthcare institutions were thinking that outsourcing was mainly for these big brands you're referring to.
Yes, that's
So
good.
they were not realizing that outsource is to eliminate their main pain points.
Right.
So outsourcing 40, 50 internal processors or like call center agents or referrals, they were thinking that that was not something that it was even in the market. If you kind of go back in the last 10 years, it's very common in our experience that most of these clinics and FQs and hospitals, um, they had their own operations because they were not thinking that outsourcing was even an option for them.
Right. Good
So
point.
that's why we we even name these as there's no other option, and
Right.
it's for us to explain them and show them that it's actually the best that they can do,
That's right.
even though that they don't have these hundreds of positions like a telecom or a bank or you name it. It's not necessary because these ad hoc solutions we provide is actually what it ended up making a difference.
Yeah.
So that's why other industries start earlier, but healthcare kind of got behind on this. So now
Yeah,
you're
they got behind. And the thing that I've noticed, obviously, especially in community health, and I think this applies to a lot of other aspects of healthcare, not just community health or nonprofit health, but they got in a mode, and this is a good thing. This is not, I mean, it's understandable here that they start thinking, we need to create jobs locally. And so they've always gotten in this mindset of, creating jobs locally in the local community. And that's very good. That's excellent. And that's fine as long as it's sustainable. But what we're seeing now over the last, especially the 5 years, you look at the 2020s here, healthcare finally reaches an inflection point. Post-pandemic workforce shortages, rising costs, and technology maturity make outsourcing not just viable, but now it's essential. It's critical to be doing this. And I have seen, Adrian, and this could be part of the industry we're in. This is partly our own fault because there have been and there are a number of companies in this industry that have done a pretty poor job. Would you agree?
yes,
You know, we've created a reputation within our own industry of a lot of companies that they don't have a passion for the customer experience, or they don't have a passion for the patient experience. They may not have management that is really attuned to the details, because outsourcing means taking these critical but expensive workflows that are not directly related to the service or product you're delivering and letting an outside organization handle that. But what's critical is that organization you choose needs to have a passion for what you do. And if you're in healthcare and you are handling scheduling and you've got people calling, patients calling that really need to see their doctor, you need to be operating from the standpoint of, like, although they're employed by us, these employees who are handling these scheduling calls are employed by our client. And a lot of outsourcing companies have done a poor job of that. And hence, healthcare organizations, many different organizations have had bad experiences. Have you noticed that? I mean, I've seen this term, Adrian, and they say, well, we've tried to do that in the past and we had a bad experience. Calls were going to India and nobody knew who was handling the calls and this and that. What's your take on that?
Yes, no, I think the key word you just mentioned, Steve, is that we're dealing with patients,
Yes.
and most of the outsourced companies on when with their general population, when they think on BPOs on outsourcing, they think like just into three main buckets: consumers, customer service, sales,
Right.
tech support.
Yeah.
And this is not any of that. We're dealing with patients,
Right.
and that's just a completely different game. And that's why it requires this level of dedication and attention that you're talking about, that we have as individuals and as organization, that ended up making a difference, because we understood since the very beginning that we're dealing with patients, and they need above and beyond uh, service and treatment, because
That's right.
it's not.
I think what Adrian, I think what I've seen, and I just a chance for us to just share our thoughts on this with an audience, and is we are it we're both founders of this organization, and we are very passionate about the customer or patient experience, and it really drives us every day. And whether it's us or any other organization that you look at for outsourcing various administrative workflows or work tasks, you really want to understand the C-level management team and what is their motivation. What is driving them as an organization? Are they truly committed and passionate um, about the business they're in? Because what we are is we're taking on a lot of these HR headaches. Some people view us as an HR company, which I guess you could say that we kind of are. We're taking on all those roles. We're establishing and building a culture, and the culture we build within the organization needs to be similar or aligned with our client's culture, because essentially the people we have trained and staff to do this, handle scheduling calls, handle referrals processing, revenue cycle management, all of these different healthcare workflows, they need to feel like they're employed by that organization, by our client. They may be employed by us, but we want our employees to feel like they're employed by our client, which means they take on a similar culture as a healthcare clinic. And I know, Adrian, in operations, you running it all, roughly 3,000 people you're managing, I know you worked hard to create that culture.
That has to be the foundation and the main pillars, or on our philosophy and how to execute, is not only to put up the numbers, but to have exactly the consequences of those numbers, that we serve in others, that we serve in the patients. So even on the slide that you're sharing right now, it's to, at the end of the day, showing the results that make our clients be completely confident that we're doing a great job, and sometimes even put them in a bad situation because we're doing so good.
Yeah, that's true. Yeah.
The Golden Valley client, when they shared with us that we kind of broke a lifetime kind of milestone to overpass 100,000 appointments on 1 month.
Yeah, that's staggering. I mean,
I'll
never forget the day when the CEO tracked me down at a trade show and a conference, and he says, Steve, I got a bone to pick with you. I'm like, what happened? I looked at my colleague next to me. I said, did we drop the ball or something? What happened? And he says, since we outsource 100% of scheduling, 100% of all these referrals processing, various aspects of eligibility checks, basic aspects of revenue cycle, and a whole host of medical records and prescription refills, all these different things. He goes, not only do we have a massive savings of the labor arbitrage between California and the US dollar and the Mexican peso, which is pretty significant savings right off the top, roughly what, 40, 50%. But he said within 6 months, we maximized all of our appointments. He goes, we're looking at data and numbers. He goes, something's wrong. He goes, we don't have enough providers. And then he goes, and not only that, we reduce reduced no shows by minimum 12% to 15% in 6 months. From once we took over all the operations and started handling it all. And I looked at him, I said, well, that's a great thing, right? That's a great problem to have. He goes, yeah, but it's a real problem. Now I got to hire more and this and that. But he was joking with me. He was like, yeah, he's like, this is a great problem to have. And so that was a great day. I was like so pleased when I heard that, because I very passionate about wanting to deliver these results you see here. We're passionate about wanting to deliver these because many people who consider outsourcing, they hear about all these terrible experiences, and it shouldn't be that way. And it's just bad that there's companies in our industry that don't take it serious, but we take it serious. We're passionate about it. And I get very excited about, okay, we're 6 months into working with a new healthcare organization. What are the results? And I want to tangibly show those results. And I know, Adrian, you and I are pretty passionate about that.
Yeah, situations like United Health Centers where
Yes, great example.
they used to have a backlog on the referral for 5 months, 5+ months, and then we were able to kind of get all the backlog and be up to 2 days turnaround from 6 months to them being able to process 17,000 referrals like a month. So again, it's not because they were not able to do it, but they that's not the core business. So they were dedicated teams. That's another huge highlight I would like to mention, that we operate having dedicated teams. We don't resources.
Right.
That's why we develop this expertise. So for United, these success stories was a huge, because again, when we grasped 5 months of delays of a backlog to kind of make it to 2 days where it should be within 6 months, it's a huge accomplishment.
It's a huge accomplishment, and you're dramatically improving the patient experience. Dramatically. I mean, and you're dramatically improving the relationship that the clinic has with other providers in their marketplace. So it's a really big deal. And like you said, these types of workflows, referrals workflow, as we're talking about here, these are critical workflows. But should you really be trying to do all of this in-house? I think, going back many years ago, especially certain size organizations, they can do it in-house. But there's a point in which it just becomes too expensive, too much work, too much to manage, and you realize we're getting distracted from our core business. And so, and obviously, our company, Emerging Global Services, we're in this business. We are an outsourcing company. But whether it's us or anybody else, just spend time really understanding these organizations that you're considering to possibly handle some of these workflows, and really get to know the management team and get to know the culture and get to know what are all their training mechanisms and their hiring mechanisms and processes. This whole business is process driven, and you've got to have really robust, excellent processes, great training, and you've got to have great management oversight and continuous quality improvement. These things are critical, and we're passionate about this. We deploy this within our own organization. And that's how you get these types of results, because whether it's us or any organization you use, they should be solely focused on driving value for you. That needs to be their core passion, and what drives the organization is in 6 months wanting to see what these results are. That should be something that's very important to them. And then obviously ongoing. So now we're going to move on to the next subject that's really big in the marketplace, and that's, artificial intelligence. And technology. And as Adrian, as you said early on in our opening, we are, I mean, we're in the labor-based business, right? And you have to love people, you have to love this business to be in it, which we do. But we have to also really love technology, and you have to really embrace technology. And we as an organization have chosen to do that. Artificial intelligence is really staggering when you really stop and think about what it can do and what it's doing and how it's fundamentally changing daily workflows for individuals and organizations. Every day we use it, it blows me away what it can do. And I'm also astutely aware of all of the security risks around it. And I guess I should mention, Adrian, you and I have we're very entrepreneurial, and we've developed and have been developing, as well as work with outside experts on developing a robust AI technology stack. But did you want to share some of your thoughts as well on this?
Yes, we always have the approach that, as you said, we're labor based, but what it makes a difference is we keep the data driven, everything process orientated, and then bringing the technology to optimize and maximize results.
Perfect.
So that's what the three components that we kind of manage everything. That's what it ended up giving the specific results on a specific activity. So breaking it down as a very general and very operational level, these three concepts is to identify if maybe the process is not optimized. Well, let's fix the process.
Right.
Then what the human, the operational components from a human standpoint, what's the productivity?
Yeah.
Let's trigger that. And then is what of these processes could be either automated or optimized by technology. AI is not only to, it's not coming to replace any human. It's just to kind of make it more productive.
Make it productive. Correct. Yeah. I remember, back in the middle of COVID, when ChatGPT came on the market and AI really hit the more public scene versus just the people in the know. And I remember experimenting with this technology and thinking, how is this going to change not just our business, but how is it going to change business worldwide? And from what roughly 2022 until now, it's very interesting to see how it's being utilized and how it's being adopted and how it is changing. But I think you just said it. It's data in, data out. It's as good as the data that's fed it. And I think one thing that's helped our organization, and I think this is important for anyone listening to consider, is when you're talking to suppliers or vendors and they're talking about deploying AI, or they have an AI tech stack that they would like you to consider, you really want to look at, does this organization have a fundamental understanding of the core workflows to begin with? So they might be able to quickly develop bots and develop, and there's a lot of tech now that can create all kinds of AI robotics, all kinds of workflows that can be automated. But what's the fundamental core of how that bot is being developed and being trained? Do they have a fundamental knowledge of a scheduling workflow, as an example? And so I think what's given us an advantage and enabled us to start to adopt this, what we call a hybrid human AI model, is we have both humans, and then we've developed a technology stack platform within our organization. And the two are working seamlessly together. And the goal isn't like, oh yeah, we're trying to eliminate 50% of jobs. No, we're trying to drive 100% productivity wherever we can. And maybe it's a situation where, yes, suddenly that bottom performers, those people who turn over, or those people who come in your organization that sometimes aren't going to last, You get to the point with bots, you can replace some of those roles, so you keep your core employees and you keep everybody working well together in a hybrid model of humans and these bots working together. This little example here is just an example of scheduling. And here's a bot that, can I schedule a meeting with my general practitioner? Of course. Please let me know. Please let me know what the meeting is for, so I can help you schedule the meeting. That's our bot just talking in a natural language voice to a person calling. And then you can see how quickly the bot can actually help enable scheduling. As long as it's plugged into the database, it has to have access to the database, just like a human being has to have access to the database. But you look at how a bot can supplement peak times, or times when you have a large number of people sitting on hold, and these people want to schedule appointments. What does that mean? That means revenue. That means filling up your calendar. You're filling up your provider appointments. You don't want to drop those calls, but you don't want to have to hire another 50 people or 30 people for 4 hours just to handle the influx of calls on like a Monday morning. Is that right, Adrian? That kind of a thinking?
That's exactly what it is, especially in healthcare. Mondays and Tuesdays are like the heaviest days, and it's almost impossible to staff accordingly to those volumes experienced on those days.
Right.
When solutions like the bots to answer basic type of calls is where we bring like a solution that it's gonna trigger again what it makes sense to the clinics, that is to set up the appointments to get people to show up.
Yeah.
So that's when we see it on even on data on all of our clients. The show up rate for appointments increases at least 30%.
Yeah, it's dramatic.
So again, by optimizing or providing the solutions that make sense on any particular situation, especially, you nail it, Monday, Tuesdays are really, really almost impossible for every clinic to stop accordingly.
Right. And then the other thing it can do, which we've seen, is we've been deploying bots that can make these outbound calls to confirm appointments. And I think stats and data shows that when you confirm appointments, you have almost a 50% or 40 to 50% reduction in possible no-shows if you just get people to confirm. Is that right?
That's exactly what the numbers for Mary Center. We start to do appointment reminders, appointment confirmation, no show ups, follow ups.
Right.
All of these not only focus on the inbound, but the outbound to kind of get the overall, and that triggered the show up rates dramatically. So
yeah. So now Mary Center is another one of our clients out in the DC area, and they are also a community health organization, and now they don't have to necessarily always be paying. They don't have to hire. Normally they'd have to hire extra people to make those calls, but then but they don't want to do that. It's expensive. And then you've got your internal team handling inbound phone calls for scheduling or other tasks. But then you're like, okay, we got to make these calls. When are we going to get it done? Well, we can't take people off the phones when calls are coming in. So you use a bot to just start automating and handling all that work behind the scenes, and you drive your efficiencies and productivity, very, very high. So I thought we'll move on a little bit here, talk about live workflow optimization before and after. So we've been talking about, traditional call centers, from the 1990s, 2000s, different industries. Obviously, we're talking healthcare. Healthcare has been one of the later adopters of outsourcing. And you look at the traditional in-house model, incoming calls, wait in queue during peak hours. We were just talking about that. Staff have to juggle phone, walk-ins, clinical interruptions. Messages pile up overnight and on weekends. Referrals process when the staff, quote, has time to get to them. Authorization delays cause appointment cancellations. Revenue cycle tasks create constant backlog. 30 to 40% of calls go to voicemail. Now, these are general stats that we've seen across lots of different types of organizations. Referrals take 4 to 8 days when they should be done in 24 hours. no-show rates climb.
And let,
Go ahead.
let me tell you, Steve, and some of our clients even have very dated technology, and they're just think it's going to be really complicated to get newer or more sophisticated solutions.
Right.
That's when we kind of bring. I'm not mentioning the name, but we have a client that he was not aware that their voicemail was getting filled out, and patients were not even able to leave a voicemail because their system was so dated that they were just getting busy tones and they were not even missing.
Oh, wow.
Or even on the volumes, they were handling again, very um, old system where they not even had like the numbers of calls they were receiving, how many calls they were in queue.
Right.
So by coming us and doing an assessment on their process, realized that one of the root cause was their system, and that's when we can come in and offer our own system and our own solution. And now it's like they were not even aware everything that they were like not handling, and obviously there was a lot of frustration on the patients in the area because they literally were not able to get someone on the phone because the phones were not uh, enough to receive the volumes.
Yeah. So they didn't have enough phone lines. They had an old system, right? If I recall.
Yeah.
And that's one thing. Yeah, the telephony platform. Sometimes it's called CCAS or Contact Center as a Service. Um, that's actually is a very good point you raise. Is having a very robust, sophisticated telephony platform, CCAS platform, is really critical in 2026, um, especially when you want to integrate new technologies and AI as well. So, yeah, when you look at when you outsource these tasks, you allow an organization to say, "Listen, we can't handle all this. Let's get some outside help." Look at the optimized outsource model, 24/7 call coverage. Every call gets answered immediately. Dedicated teams by function. So we have dedicated teams scheduling, referrals, billing, obviously revenue cycle, all these different workflows or administrative workflows. We have dedicated teams doing that are highly trained and skilled on those for those clients. Real-time electronic health record integration and documentation. This is really critical because especially as you're going to integrate a hybrid model or integrate AI, you got to have real-time access to data for the technology to be able to leverage the technology. Proactive outreach for gaps in care, same-day authorization processing, continuous workflow improvement cycles. I mean, you're looking at what, 85, 90% answer rates, and now referrals get handled in 48 hours or less. Your no-shows start to drop. I mean, there's a lot of other results we could probably list there, but just being willing to say, you know what, let's try this. Let's take a look at what are the steps to do this. If we want to just start experimenting with outsourcing, and let's keep it low risk, and that's how it should be done. I mean, especially if you've never done it before. It's
Let me share with you, Steve.
go ahead.
West Side, they
Oh yeah, right.
historically they were around 30 plus, even 40% of Adama rate. So when we went down to a single digit, 6%, 5%, they just couldn't believe it because they never really operate under those standards. I
Right.
think for that it was just like combined efforts. But again, is what we've been saying multiple times in this conversation is like because they're not experts on it, and that's fine. That's not their core business. But
Right.
when you give it to professionals like ourselves, then we focus on drive those results down.
Yes. You get the people who really know these workflows, are really focused on them, and yeah, you free up their team to say, wow, we can focus on other workflows, other tasks within the healthcare organization that are impacting patients. And then you're freeing up tremendous amounts of cash within their budget, especially with these new policies in Medicare, Medicaid that are coming down and reduced reimbursements and things. You've got to start optimizing. Um, So we'll move on here and talk a bit about, how do you go about this? What's the right way to think about? If you've never outsourced before, it can seem daunting. It's scary. It's like, are we losing control and are we going to have a lot of problems? And then, like I said earlier, or we talked earlier in this session, there's a lot of horror stories out there about outsourcing, and unfortunately, they're real. And a lot of organizations have created that. Other outsourcers have created that, but we talked a bit about how important it is to really identify the right one for your culture. But, you want to look at it in the rule of thirds, phase one. What's the first third? How do we think about that? Well, let's just look at your workflows and start with high volume. It doesn't even necessarily always have to be high volume, but, something that is higher volume, that's hard to handle, but low complexity workflows. Appointment scheduling reminders, that's a very common entry point or workflow that I know healthcare organizations say, let's start with that. I think you've seen that, right?
That's correct.
And then you establish protocols, you get the team trained. I think it's important. You just get the relationship working between your organization.
Yeah. Yeah, that one of our core values, Steve, is that our clients needs to feel that we are an extension of their own teams.
Right.
We don't build our teams as an outsiders, as we just take care.
Right.
And we take it for granted, but it's not how the rest kind of operate. Where our clients have direct communication with our frontline, that's not necessarily usual. So, and we always say that to our client that we want to be a true partner, not just a service provider, like an outsider. And that's what is ended up making a huge difference, because every single client of ours have direct communication, daily communication with our frontline supervisor, with our frontline agents. So that's why this third strategy. The first one is, as you said, that the less complexity, but also for them to get to know our team, to get the confidence, to get the guarantees that we know what we're doing, and then we go to the more complex stuff. And we always are like working with them together.
Yeah, because we have to address. There's always the fear of, we've been doing this in-house for so long, and we have control. Things may not be perfect, but you feel like, okay, we know what we're doing. We've got these processes that appear to be working, but we still have issues. So you start working with an outside provider, and that's a big cultural shift, a big behavioral shift. And, we want to make it simple, easy, and hassle-free for them. And we want them to feel like, yes, you're working with our team or another company's team, but we are just like your team. And we are, we are going to be, we're just a text away, a phone call away, you know what I mean? Or video call away. We're right here. We're dedicated to you. And you start to just develop the working relationship of working with an outside party, which is a cultural change and a behavioral change. And I think that in this first phase, you pick a workflow that's relatively simple. It does have a nice, positive, high impact on the organization, but it is an easy way to get started. Scheduling is a very simple, easy, straightforward task. So I've found that scheduling is popular. I know, Adrian, we've had teams that start with referrals processing too, if I'm not mistaken.
Yes.
So that's another workflow that you could start with. But then, the second phase is you can, like here we're talking about, say you started with scheduling. In our experience, we've had a lot of healthcare organizations that they expand to referrals coordination, referrals processing, insurance verification. And we gradually take on other roles and other tasks. And this is after we've developed a good working relationship with the client. Maybe it's 6 months, 9 months, 3 months, just depends. But And you just go slow and develop the relationship. Just like if you were implementing a new initiative within your own organization, you're probably going to take some time and roll it out. And then, the final step would be adding in even more complex tasks. Or, here you got revenue cycle functions, eligibility, prior auth, claims follow up, I guess billing, and a lot of this stuff could be put in here. And so this is how we've grown. I know, Adrian, with various clients. I think it's worked pretty well, right?
No, yeah, actually, I can give you some wins that we've done with clients like ours, like Akawia Health, where
Yeah, that's right.
the revenue growth increased like 26% on the year. So we
That was all. That's mostly revenue cycle, right? The hospitals.
probably is.
Yeah. All right.
So like the reduction of the age accounts receivables to reduce it almost 85%. Like
Right.
again, where these activities could be taken as a more complex, but still we can show all the productivity increases and optimization that having these dedicated teams ended up making a difference.
Right.
So that's another angle or another line of business that we've been really successful.
Yeah, that's a great point because I know we really took time to develop the relationship and the working relationship with them, and have just grown the relationship over a year and a half, or coming up on 2 years here pretty soon. Um, so yeah, we'll be wrapping things up here for those who are listening, but I guess getting back to this concerns about outsourcing, there's always concerns around quality and the patient experience. There's a lot of data that shows, and you when you choose the right provider, the right partner, you achieve higher patient satisfaction scores through specialized training, consistent processes, and consistent focus on quality monitoring. When you work with another party, another organization, and you outsource these functions, you get an organization, if they're the right one, that is passionate about this. This is all they do, and they're heavily focused on it. Whereas when you have your internal teams, there's a lot of multitasking. There's a lot of work that's being put on them, and they're sort of doing a, a lot of things okay, or they're being tasked to do lots of different types of work, and there's only so much time in a day to get work done. So there's just a lot of multitasking, a lot of other work, and they can't always be solely focused on just this process or this process. And when you work with an outside provider with the right service level agreements, and the right training and the right processes and the right focus, you start to see dramatic improvements in productivity and efficiencies. And then, I want to mention here HIPAA and compliance. Security is a really, really big deal. We're talking healthcare. We're talking patient health information. Um, you know, uh, Obviously, reputable partners maintain strict HIPAA compliance and business associate agreements and regular audits. We do all of this, and anybody you work with, you probably have a pretty strict security compliance process you go through, which is very important. Um, and then the last point here is change management. This is also another big concern I know that we've seen with adopters, healthcare organizations who adopt outsourcing, and staff anxiety is real. But you have to communicate upfront to the staff, that your internal teams, what your policy is. This is who we're engaging, and be very clear up front about what we're doing. And one thing I've seen, Adrian, if I'm not mistaken, is we have a lot of clients that it's not like they do some big layoff. They really kind of, a lot of them couldn't staff enough people to begin with. So we get started filling in those gaps. But then as attrition happens, they hire with us, if I'm not mistaken.
That's most of the strategy with everyone, so they can do even a smooth transition locally. So, uh, yeah, we constant backfill those positions they lose, and instead of them invest not only in the from a monetary perspective, but the time to recruit, they just gonna ask us to replace those positions, and that just happened because we developed and established this confidence on phase one, as we were talking about. So it's like the little by little start to giving us more and more. I can say Camarena Health, we start with a little piece on scheduling and a little piece on referrals. Now we kind of manage almost everything. So
Well, you manage just about everything for them. It's on there.
it was gradual growth. So yeah,
We we've worked hard. We've really developed the relationship with them, and we've really worked to develop the the culture and the relationship and the investment. So it's a really important. We really work hard to develop these partnerships, and we're an extension of their organization and their brand, just like we're an extension of any organization that wants that puts if you put the trust of your brand and your organization in our hands, or anyone that you work with, you want them to that's a very serious decision they're making. And so we take that very serious. And it's very important that outsourcing providers take it very serious when another organization puts trust in them to handle their workflows, especially for patients. The last thing I want to touch on here in our discussion, Adrian, I know I've seen this a lot, and it's like, and you see this in healthcare a lot, but not just healthcare. You see this in lots of industries. We've always done it this way, and that's why we can't change. It's very hard to. Can we really consider outsourcing these functions? We've never done that before. We've always done it in house. But every month that goes by, and you stick with that same mentality and thinking, you know, you're you have lost revenue, you have expenses increasing. And when I look at a lot of the data, especially in community health, since we do a lot of work there, I looked at the data for the state of New York, I looked at the data for California recently. And if organizations don't make changes and don't start offloading these workflows and these costs to the right provider, you're looking at what? A negative net operating loss, 5%, 10% net operating loss. And no organization can function that way. And, I know there's a lot of thinking also that's sort of like, we always have to hire and create jobs locally. Well, that's great. And you're doing that. But if you're taking, funds, taxpayer funds and grants and things, there is this fiduciary responsibility to manage the business, and certainly not manage it in a way that's a net operating loss, especially if it's a nonprofit organization, So you have to be making and looking at some of these tough decisions instead of we've always done it this way. What are some simple, cost-effective, ways we can start to move some of these workflows out of the organization so we can shore up our financials and continue to focus on patient care. At the end of the day, that's the business we're in, is delivering patient care. And a lot of these tasks, scheduling, and all of these, especially in insurance verification and referrals, all this stuff is sort of, they have to do it. They're required to do it, but it's not fundamental to what business they're in, So, any final thoughts you want to add, Adrian?
No, I think we cover like the main topics just to reinforce how we operate as an extension of the current teams.
Right.
Are very data driven, process orientated, and digital or technology optimized. Those are our three main pillars that we operate. And I know if you guys give us, any of the audience can give us the opportunity, we know we can deliver the results.
Yes. The key is delivering on the metrics that are required. And outsourcing is one of those tasks that it's not just, it certainly is a cost savings. There's no doubt about it, but it's also a really driving productivity. But at the end of the day, it should be done in a way that's really shoring up and making things better for the patient experience. And if it's not doing that, either there's problems, or it's the wrong provider, the wrong partner, or what have you. But I know in our experience, everything is about the patient experience. And so you look at all of these little details, all these little workflows, everything's in the details, and you focus on those, and you drive productivity and outcomes that way. So I guess we can wrap things up. I don't know if people have any questions at all. I'm not sure. It's been kind of nice to be able to just have a conversation, Adrian, and talk about some of these, because you and I talk about this a lot every week. And so I thought it would be nice to have a venue where we can just share some of these thoughts that to get some more people thinking this way.
Yes.
And if there's no questions, we can wrap things up. No problem at all.
I believe no. It just we got a message from Joyce. We're gonna need to follow up with her.
Okay.
How do we maintain HIPAA compliance on data security when outsourcing patient-facing workflows? We got that question. Well, instead of the HIPAA regulation that we follow, we do have certification like SOC 2 that are very strict from a data protection and manage.
Right.
We are PCI compliant as well, where we don't allow, for example, paper on our floors. Very practical, where we guarantee the security not only from a network and system standpoint, but also from a physical and location standpoint. So
Right.
that's a really good question, because security is one of our main topics, not topics, but something that we always aware and doing this assessment twice a year. So we have a third party doing certification on us. So we're very compliant from a security standpoint as well.
I know, Adrian, there's a lot of organizations that have deployed work from home employees, right? And across the United States. And I've always personally had concerns about that, because how do you really secure the physical environment? On our work floor, none of these phones, none of this is allowed. And, there's no paper. Everything is glass. We have cameras everywhere. We have fingerprint file access. Everything's through fingerprint just to get in certain doors. Then, like you said, we have a really, locked down network, physical IT network. And we're not storing data, either in Mexico. We're just accessing data through secure systems. But the physical security and management of labor and physical security is very important. I know we have very strict protocols around it. So it's a very good question.
Another question I have, Steve, is now that AI is what most companies trying to implement, how secure is that in the process? So that's a good question as well, because we develop our AI by integrating with our client system. So we actually work together and we follow our security along with our client security. So
Right.
we don't, that's very important to make the difference, where our AI solutions are unique for our clients. It's not that a product you find on the internet that do this service and you need to adapt to it. It's actually the opposite, where we adapt to our client systems.
Right.
So they need to grant us access to kind of be integrated to work effortless and more efficient, but also with the security that the platforms you utilize, and plus our securities as well. We, from an AI standpoint, everything is from the higher standards from security, from a service standpoint, and it's just the best of the best that is actually available.
And I know we run everything on all of our platform and technology is on Amazon Web Services stack. But I also know like you were saying, if we're going to have an API into Epic or an API into NextGen or whatever electronic health record it may be, we're doing that in an agreed upon highly secure environment or server environment agreed to by the client. So it's either done on their side or it's done on the AWS side. But yeah, everything has to be done in highly certified server environments. That's for sure. That's how we deployed our tech stack. I do know that.
Yes. And that's it, Steve. I think those are the questions.
Well, we'll wrap things up. We appreciate those of you who joined and listened in. We hope that you found some valuable information or tidbits that you can take away and think about. And feel free to reach out to us anytime with any other questions. So thank you, everybody, for joining. Enjoy the rest of your day or afternoon or evening.
Thank you, everyone.